Dr. Weiland, thank you so much for taking time out of your busy schedule. There's a lot going on, but we want to first start to talk about, there's a new way that you guys are using to treat COVID. Let's talk about it.
That's correct. We've been talking so much lately about people getting vaccinated, and that's still very important. But a new tool that we've had recently is called monoclonal antibodies. This is actually a form of passive immunity. You have two kinds of immunity. You have active immunity, which is what vaccines give you. You take the shot, it tells your body to make a protein, and then your body makes antibodies for the time for when you see whatever germ or virus it is that you're trying to fight. That's called active immunization. It takes a while to tell your body to make those antibodies. Yeah. So if you get COVID and you either haven't been vaccinated or you're in a very high risk category where you might need more help and you might be someone who ends up in the hospital or on a ventilator, we have what's called monoclonal antibodies. One brand is called Regeneron, which people may have heard of. This is administered, when this first came out, it had to be administered IV you had to have an IV put in, and then you received the infusion at your doctor's office, so you could be watched for any kind of side effects. It recently has been approved to be given sub-Q. So they break this dose that went in the IV into 4 shots, and you get the 4 shots in 4 different places, and it works about as well as the IV infusion. And what it does is it gives you those antibodies that your body will make if you're immunized. But that for whatever reason, either you're at high risk or you're not vaccinated, you're not making them. Yeah. So this is giving you the antibodies to fight off COVID.
How do you guys know when you're going to use this method?
It is being used more now that we can give it sub-Q. Again, it was a little bit more restrictive when you had to have an IV and get the infusion. Now it's going to be easier to get, and anybody over age 12, and you could use it over age 12 and over 88 pounds, can receive this. And Dr. Dobbs and the State Department of Health is actually encouraging physicians to give this as a treatment. Now, I will say it's not going to replace the vaccine for most people. You're still going to have to get that vaccine to get yourself good protection there. But this gives us a tool to help people who are positive for COVID. There is a hotline from the State Department of Health, 877-978-6453. That could give you information on where to get vaccines, where to get the monoclonal antibodies treatment. The most important thing about getting the monoclonal antibodies, MABs, is to do it as soon as possible. It works best if you do it as soon as you know you've got COVID, as soon as you know you're sick. It can be given up to 10 days later, but really the sooner the better. It'll keep you out of the hospital. It'll get you better quicker, and hopefully will keep you from having any of the bad side effects, the long COVID issues that we've been seeing. And then there are treatment centers in Vicksburg where you can receive this. Now it's passive immunity. So you're given these antibodies and they will last in your body about 90 days. And you really shouldn't get the vaccine until after 90 days because you have that passive immunity and your body's not going to make its own antibodies because it has the antibodies there.
And Dr. Weiland, there is a big strain on medical workers right now.
Absolutely.
First responders as well. How do you, just as a doctor, how do you cope?
It's been difficult. And again, I ask our fellow Mississippians, do what you can to help us. I hate to sound like a broken record, but get the vaccine. Try to stay healthy. If you think you're sick, don't go out to the grocery store and don't go out and mingle among people. If you're asked to quarantine. If you're positive for COVID, even if you've been vaccinated, the State Department of Health is asking you to stay home for 10 days. Now, that's a little extreme because you are already vaccinated, but they feel that you could transmit the virus even though you may not get that sick yourself.
That makes sense. Well, thank you so much, Dr. Weiland, for your time today.